Finding the right treatment for her pink, itchy, and balding scalp was a 15-year battle for Vinay Kimpson.
It was difficult to, muster up the strength to go out every day.
She had psoriasis and a condition known as CCCA, or central centrifugal cicatricial alopecia, found mainly in women of African descent. Kimpson says the combination of the two diseases was severe and life-altering.
It did impact my self-esteem. There was some sadness. The only thing that really kept me going was my faith.
She consulted several doctors before finding Dr. Andrew Alexis, director of Mount Sinai's Skin of Color Center, who was able to treat and reverse both conditions. He says psoriasis in people with darker skin tones is often misdiagnosed or treated incorrectly.
One has to take into account their hairstyle, their hair washing frequency, their overall hair care practices, and weave in a regimen, a prescription regimen that's compatible.
A 2016 report out of the American Academy of Dermatology found nearly half of the 5,500 African American women surveyed were experiencing some form of hair loss. Dermatologist Dina says more and more women are coming to her practice with CCCA.
Relaxers and weaves are relatively new. I mean, they've been around for decades, and we've definitely seen an increase. Maybe it's the degree, how aggressive people are in terms of, changing up their style. This is something that we're trying to better understand.
Excessive repeated heat or chemical damage to the scalp may lead to CCCA, but tension, tight braids or weaves is a major risk factor.
The longer one waits to get it diagnosed and treated, the more permanent damage of the follicles.
I think it's very important to get a diagnosis before you start treating your hair loss. Many people, they're trying things they see in the store and ordering things on the internet, and different types of hair loss are going to require different treatments.
Erin Billups, New York 1.